In today's health headlines, the benefits of Ozempic for people with kidney disease and diabetes. Microplastics have been found in men's testicles, and what is driving the stroke increase in younger adults. Lots to talk about. Joining me is Dr. Nate Wood, internal medicine and obesity medicine specialist at Yale Medicine and instructor at Yale School of Medicine. Welcome on this Memorial Day weekend.
Yes. Hi, Ann. Thanks for having me.
You bet. All right, a major clinical trial has found that Ozempic can lower the odds of death and illness for people with kidney disease and type 2 diabetes. Tell us more.
Yeah, so this is really exciting because it's hot off the press. New England Journal of Medicine just this morning, really fantastic study. And what they did was they looked at folks who have both type 2 diabetes and chronic kidney disease. And to be clear, that's a lot of folks. So what they found is that in folks who take semaglutide, which is Ozempic, that they had much lower rates of experiencing serious complications from chronic kidney disease, progression to things like kidney failure, needing to go on dialysis, and even needing a kidney transplant. So these are really life-altering severe consequences. And again, Ozempic was really, really helpful. Now, what's so important about this is a lot of folks have chronic kidney disease, but we don't have a lot of medications that can help prevent these serious side effects, that can help kind of protect the kidneys from getting worse. And so whenever we have a new drug that can help, it's really big news, and that's what we're experiencing this morning.
All right, new research has found that microplastics, which may impact male fertility, are found in men's testicles. It seems like we're hearing about this plastic stuff all the time.
Yeah, I was just going to say, I don't know about you, but I feel that way too. You know, it feels like we were never talking about it, and now we're talking about it all the time. But it's for good reason, right? Because every day it seems like there's a new study finding that these microplastics are hiding in a new place in the body. And so we know about microplastics in the plaque in our arteries, and plaque can increase the risks of heart attacks and strokes, right? So that's concerning. But now they're being found, like you said, in human testicles. So the question is, what is the significance there? Well, globally, we've been seeing for some time now decreases in sperm counts, in male fertility, right? And so the question is, are they connected? And that really is the next question for researchers to answer is the microplastics to blame, or is it something else in our environment? And right now we just don't know.
And more younger adults are having strokes, which is alarming, with obesity and opioid use potentially playing a role. What more do we need to know?
Yeah, and like you said, this is alarming. And I think it speaks to a larger trend that we're seeing, which is in these negative health consequences that we used to only think of being in older folks, we're now seeing them in younger folks too. And so the other big example I can think of is colon cancer, right? We had to move up screening into the 40s because of how many younger people were getting colon cancer. And so this same issue with strokes is something else we're seeing here. They're getting this at younger ages. And so researchers have looked to say, well, what else has been going on over the past few decades that could explain this? We've seen increases in opioid use, like you know about the opioid epidemic, and of course, increases in obesity. And my guess is that probably both are leading to this increased risk of stroke, but that this is really, again, just my guess, driven by our consumption of ultra-processed foods, which are leading to lots of negative cardiometabolic health consequences like obesity and like strokes.
All right, thank you so much. Have a great weekend, Dr.
You too. Enjoy your holiday.
I will.
Thanks, Ann.
All right, take good care.
You too.